Hi, Natalie. Hi, this is Ruben. Um, just want to introduce myself once again. My name is Ruben Zavala, and just want to ask you a few questions. Thanks for coming on this interview on short notice. Just going to ask you a series of questions, and one of them is going to be to please introduce yourself.
Sure. Sure. My name's Natalie. I am a hospice nurse.
Okay, and could you, the first question I'm going to ask you is, could you tell me about your daily duties as a hospice nurse?
Yeah, so I work for a company, it's a hospice company, and a lot of times my job entails going to hospitals that we get requests from. A lot of times a social worker will reach out to us. Maybe a family is not, a patient is not doing well, and the family is inquiring about hospice care because they want their family member to come home with them. And they have a poor prognosis. So, what we do is we'll go into the hospital and just talk with the family and let them know what it is we do. And if the patient is able to discuss also, sometimes we can talk to them, but it's very rare. And our focus is just on comfort management and making sure that the patient gets what they would want at the end of life. And we deal with different types of patients. So a lot of times it'll be an oncology patient or terminal illnesses that are diagnosed. So there's a lot of emotional parts that come along with that. And facing death is always a difficult thing to do. And so because we have experience with that on a daily basis, families tend to lean on us a lot, and we're able to just kind of be a resource for them, as well as just a shoulder to lean on. And a lot of times we kind of take in a different aspect where we're able to be also counselors and things like that for the family members, not just the patients. So anyway, we can provide, sometimes once the families decide that they want to do hospice care at home, we can help coordinate how we can get them home. And then once they're at home, depending on the level of assistance needed, we'll come and assess the patients and see what, maybe if we have everything or if we need more equipment, either oxygen or pain management or what have you. So yeah, just there's always a lot to do, and just kind of a holistic aspect of care is what we do.
Thank you for that. And what made you want to become a hospice nurse?
So I used to work ICU, and we deal with a lot of that in the ICU, and by that I mean end of life. And a lot of times we see the difficult part at end of life, where maybe the families didn't get closure, or it was we did every treatment possible and it seemed more painful than it was comfortable. And so with hospice, I think it gives you a dignified end of life. And I would want, if I thought I wanted more families to know about it, and so that I could help give them that opportunity. And I thought I would be a good resource for information on how to do that and what the alternative would look like. So, yeah.
Sounds good. What is the most fulfilling thing about your position?
Yeah, I think being able to help people and make the patients feel comfortable and not um, stressed at such a difficult stage in their lives, the end of their lives. And then also being able to help families, like you build a pretty good rapport with them. And so being able to help families through something that nobody wants to deal with, but we all will deal with at some point in our life.
Gotcha. What is the most challenge? Would you say is most challenging?
um I think um maybe sometimes getting the patients comfortable, because terminal illness is not always graceful. And so I think that making the most graceful exit out of here is sometimes difficult to do. So just the logistics of things, getting medications and things like that in time, and just being there for the families, resource wise.
Yes. So my final question to you is, what advice, if any, would you provide for nurses that would like to become a hospice nurse?
Do it. I think it's a great opportunity. You could help a lot of people, and again, death is something that not very many people talk about, but we all will deal with in our lifetime. So I think it's a really unique perspective to have, and I've thoroughly enjoyed it. So I recommend, if you're interested at all, to either do that, or at least there's different certifications or like symposiums that you can go to learn more about palliative care or hospice care and things like that. So to be more acquainted with it.
Well, I thank you, Natalie, for coming on and sharing your knowledge with us. And once again, I said thank you for coming on short notice.
Sure, no problem. Thanks, Ruben.